Well, friends, welcome to today's webinar. And today we have a very, very energetic person who is uh, doing a lot of things. She's none other than Dr. V.N. Mahalakshmi. She is a Dean Health Professional Education and Professor of Pediatric Surgery at AVMC Pondicherry, and also Dean of Faculty Interdisciplinary Studies at uh, the VMRF University. She is besides being an MCH pediatric surgery, she has done FRCS from Glasgow and uh, who certified in hospital management, and also a Harvard Macy scholar. And she's done acne and pursuing FAMER, and she has completed a certificate program on assessment in health professional education. She has done the simulation training from University of Miami and Paddy Stars. And uh, the, the list is very long. She is co-chair of MEU, Director Simulation Center at AVMC, India representative of Asia Pacific Consortium of Standardized Patients, member of National Level Expert Committee for Inclusion of Palliative Care, and also the MEU mentor in BLD University, National Faculty, Paddy Stars, and member of Expert Committee at Rajiv Gandhi University for Certified Simulation Technician Program, and uh, has been the controller of examination at Balaji Vidyapeeth Puducherry and vice principal curriculum at Mahatma Gandhi Medical College, Pondicherry, and also she has done written many papers, and uh, was part of many curricular reforms, and or also organized a number of the medical education unit activities and simulation activities, and 5 best paper awards, book chapter, 15 publications. I mean, the list goes on, and you all must be very familiar with the annual conference which he organizes, and I don't know how she manages so much, but she's a big asset to the country, and we are very honored to have her on our platform. Thank you, ma'am. Over to you.
Yeah. Thank you very much, sir. Good evening, friends. It's nice to be back in MEU India forums, meeting you all in virtual. So me and Dr. Sanjay keep talking about what we can do about medical education and which direction we need to take this across the country. So when we were discussing recently, so he was telling, why don't you do this session? And I suggested to him that we could do this topic on cognitive bias and how we can overcome this in decision making. So basically, I am quite interested in cognitive science. If you look at my area of interest, I like assessments, especially performance assessment. So when we talk about performance assessment, bias also comes in. So how do we overcome cognitive bias? The bias your brain creates, especially when you're making critical decisions. This is something which has been quite interesting to me. And I kind of go and try to read up what interests me quite deeply. So that is how I got into this topic. And I thought there are some nice insights which we need to share. And I would be using a lot of examples from clinical medicine, especially how we as a community how we as medical professionals reacted to the COVID. So I'd be using a lot of examples from that to illustrate some of my points. So this is how I'm going to proceed with today's talk. I'm going to start about how we are processing information because we are surrounded by information. So how do we go about processing this information? And when we are actually consuming this information, there is no better word for it than saying that we are consumers or voracious consumers of information. And then based on that, we come to certain decisions. Can we identify the bias we have and what fallacies can occur during this process? And is there some strategy, is there some way to de-bias ourselves so that we could think critically and take decisions accordingly? So this is going to be my agenda of today's discussion. So we start one with information. Basically, we are talking about processing information. So this particular infographic, I like it very much, even though it is a slightly older. So you can now make it at least 10 times more. So if you see, we are surrounded by information. Every minute, every second, we keep leaving digital crumbs all the way. So this we are overloaded. Basically, our brain gets overloaded with so much of information which is assaulting us, be it from YouTube or from Google or the ever-present WhatsApp and our Instagrams, Facebook, whatnot. Okay, 24/7, we kind of are assaulted. Many of us have even difficulties in putting the phone away and sleeping in the night. So we are so used to that notification sound. No, the moment it comes, we start taking out and seeing. So the first and foremost problem we have currently, it's not only that here, but it's a growing problem which we need to recognize is that we live in an era of information overload. So when we look at it, information is nothing but discrete pieces of data. The human brain, by evolution, is not processed or not tuned to look at discrete pieces of information. So what it tries to do is try to find there is a pattern between these information, bits of information. Okay, there is an accident you are seeing in the road. There is a lot of congestion, and it is showing increased time for travel back home today. So these are, if you see separately, these are distinct pieces of information. So our brain tries to connect these things. Maybe because of this accident, there is a traffic condition, and that's why it is taking much longer for me to reach home today compared to what we do every day. So this kind of pattern, connecting the dot, is what we need to do. And even if there is not much of a pattern, we try to find pattern. We try to see if there is a link between discrete pieces of information. So unless it makes enough connections, it doesn't make meaning to us. So that is the second problem we face with world today. And most of the times we need to act fast. So you see a patient who is bleeding profusely in the casualty. So the moment you see, you would want to, or you are forced to stop that bleeding. You're forced to take some action to do that. But however, if you see how the human brain processes, the brain needs to connect different pieces of information. And it is a very convoluted process. But the need is to act much, much faster. So we have to evolve certain mechanisms, certain evolutionary mechanisms, so that we could reach from here to here instead of going through this convoluted process. So the third problem we have is the need to act fast, need to process information, which is first of all very vast and which is predominantly discrete pieces of information. But your brain needs to process this and act very fast. That is it. And this is another problem, which is a very significant problem, especially with regard to the new millennial learners and the next generation learners. What should we remember? We are all familiar with Miller's pyramid. Uh, it is like I know how, show how, and do. But this is in the upward aspect of Miller's pyramid. I kind of interacting with our students, I feel that it has got two steps below. One is it is stored in my, I know how to Google. Worse than that is it's stored in my thumb drive. So those are the kind of things. So everything knowledge is available with just a click of a button. So it is no longer a premium commodity. So what we should remember, what we should look up becomes a major challenge. What should the brain choose to remember? So this is what happens. This information overload really sucks. So what happens is we aggressively try to filter that information. The noise, what sometimes we see, becomes the signal rather than the amplification of the signal we have. Lack of meaning. That is, I was talking about trying to join the dots. So if you cannot join the dots, when you see so much of discrete dots, it becomes so very confusing. We try to fill in the gaps, and the signal becomes the story. We need to act fast so that we jump to conclusions. Sometimes no stories become decisions, like what we try to fill in, we try to take decisions. And we try to remember bits from mental models. Basically, we try to form mental models based on what we have observed and what we think is significant based on that. So let me give you an example of this. So this is how the information processing funnel works. Below a lot of discrete pieces of information, okay, about various things. So you try to put it down into some heuristics. You try to put it, let us say there is a 16-year-old in the casualty, has got an abdominal pain, 2 days duration. Pain initially started in the periumbilical region and then moved on to the right lower quadrant. There is fever, there is also vomiting, and there has been no such episode. So these are kind of pieces of information. So what we try to do is to develop hunches or rules of thumb. So 16-year-old with periumbilical pain, shifting over to the right leg fossa with the focused tenderness in the mid-Burney's point is most likely to be acute appendicitis. So will a 36-year-old with the same similar presentations, 36-year-old lady, will it also be acute appendicitis? That becomes an issue. So then when we kind of develop heuristics or shortcuts or mental models, then we try to simplify it into algorithms, whether it is yes or no. We have branching trees, decision making algorithms. So this is how we process information through the knowledge funnel. This is a very interesting study or interesting aspect of within the cognitive science which came up, which got the Nobel Prize. Daniel Kahneman is the person who actually is a journalist. He and cognitive psychologist from Harvard Medical School, they developed this systems approach, systems thinking. So basically, he describes there are two systems, two ways in which the brain processes information. The first one is the system one approach. System one approach is very quick, it is instinctive, requires very little effort. Usually, it is done based on our hunch feelings, gut feelings, etc., etc. Automatic, and there is no sense of voluntary control. So, how does this work? Like, for example, if you want to cross the road, instinctively you see on either side, and then if there is any traffic, you try to avoid crossing. You wait for the thing to go, then you cross. You see a red light, you stop. You see green light, you go. So it is instinct. You don't have to think. You are automated or to think about it. So that is how system one thinking works. Most of the things we do in life, either walking, doing certain things, if you see really senior surgeons operating, how do they operate? Like many of the steps they would be doing in an automated fashion. They would be using system one approach, except certain critical steps. So this is what is systems one approach is. So these are some of the heuristics or adaptive toolbox of heuristics in decision making. We try and use common sense, right? So in a 36-year-old, appendicitis is very common. However, so can we think about pelvic inflammatory disease? So you try and see what are the common things which can also occur. You use common sense to do that. You do what is called as profiling. Okay, what algorithms really try to do. Our uh, Amazon, any of the big data tries to do what is called as profiling. You keep searching for this, you keep looking for this, so you are likely to be. So if you are a 40-year-old lady who is trying to look for uh, different types of sarees in Amazon all the time, it kind of profiles you into a viewer who is likely to be interested in buying sarees, and it keeps showing you those algorithms. It keeps showing you or sending you notifications about new things which are going to come. So we use common sense. We use what is called as profiling. We use rules of thumb. So pain starts in the periumbilical region, moving into the right leg fossa. Likely to be appendicitis. Rule of thumb. Okay, most likely is appendicitis unless proved otherwise. We do what is called as an educated guess. If it looks like your Aunt May, she sounds like your Aunt May, she's likely to be your Aunt May, right? That is what we do. Stereotyping. So if you see somebody wearing dhoti and then coming and speaking in local vernacular language, you assume that this person has this kind of background. You don't kind of think of him as a doctor or an IAS officer or a police personnel, right? So we try to stereotype people. So we use heuristics for decision making. We try to make rules of thumbs. So some other things which we can do is recognition. So I've seen this pattern before. This is the type of cells we saw in the last case of lymphoma. So this is also what I'm seeing. It looks like those kind of cells. So it is pattern recognition. One good reason to say that this exists, one good reason to say it doesn't exist. We can tally what goes in favor of it, what goes against it. So we anchor and adjust. These are all basically heuristics or coping mechanisms. Because we are overloaded with so much of information, the brain tries to filter out. It tries to simplify the process of decision making. So that is how heuristics work. So this is what we are saying. So suppose you see a blue color bird with an yellow beak, and so can I recognize this pattern? Yes. So the type 1 thinking says, the decision says, yes, it is blue jay. It's most likely to be a blue jay. I'll give you a example from literature on how the heuristics work. So this Michigan study is very famous study which came up almost 1.5 decades back. So what happens is anybody who is this was done in a rural community in Michigan. So they try to find out how many people who present with chest pain were correctly diagnosed and assigned to the coronary cardiac unit, and how many of them were incorrectly. That means they were overdiagnosed. They were admitted to the CCU. So when they looked at physicians, you found a very wide spectrum. Okay, most of the time they can be highly false positive, but they can also be highly true positive. So both were possible on either end of the spectrum. So to reduce the cost of admission of patients to ICU and to ensure that the diagnosis is achieved, they came up with what is called as heart disease predictive instrument. So they used an extensive 39-point questionnaire to try and see if this person can be profiled into somebody with a high risk for heart disease. So if you see, incorrectly admitted to the coronary care unit came down significantly. Okay, but you could also see some of them are assigned very, very high. So if you are going to use instruments which are extremely detailed, which are extremely, what do I say, data oriented, It depends on the precision with which you use this instrument, the significance you assign to all the questions, the way you answer these questions. Many of us saw this during the COVID. We were asking students, we were asking faculty, we were asking medical community to get into all kinds of surveys and all kinds of feedback. So, irrespective of what question is being asked, people used to put agree, strongly agree. Okay, there used to be a bias towards positive reporting, which happened. So, I came across quite a few what do I say, strategies how we can prevent. So in between, you have a questionnaire which is a check questionnaire. Okay, are you answering this question without reading? Yes, no, strongly agree, and all that. So you can actually have a checkpoint to see the attention of people. Anyway, going back to the Michigan study, this is what they did. Then what they did was, based on this, they said that we'll simplify the decision making process. So they asked only three questions in the algorithm. They asked, does the ECG show any STT changes? Okay, if it is showing any change, patient goes to CCU. Does the patient comes primarily with a complaint of chest pain? If it is primary complaint is yes. And if it is associated with any other factor, okay, there is an STT change or T wave inversion, or there is a response to nitroglycerin, etc., etc. If any of these factors are present, they go to coronary care unit. Others will go to regular nursing bed. So when they made the decision-making algorithm very simplified, they found that the fast and frugal tree was somewhere in between. So that shows that sometimes instruments can work very precisely depending on how you administer. The heuristics can help to make decisions or simplify decision making process, but they are not foolproof. So that is what it says. So heuristics or informal reasoning is a fallible thing. It may cause several types of unconscious errors, that what we call as cognitive errors. Basically, the way human being looks at it, our thought process works is we look at things through a lens of personal experience and preferences. So you might have seen one patient with ruptured ectopic who had presented similar to acute appendicitis in your experience. So, but that experience comes to your mind whenever you see a young married person with right iliac fossa pain. So you try to look at it through the prism of your experience. While it is effective, the limitations can cause this. So we saw till now how we are overloaded with information and how our human brain tries to aggressively filter the information so that it makes sense. And it uses heuristics or rules of thumb as a mechanism to filter the information and come to a conclusion. So this is per se with the amount or the volume of information we are looking at. We also have problems with the content, what we are looking at, the content of the information. Availability heuristic is, this is all the information in the world. This is the information which you use to make a decision, right? Recent, frequent, extreme, vivid, or negative information stays with you for in a very powerful way. So you kind of try to ascribe whatever is happening to that particular information. For example, when COVID struck, people in Taiwan and South Korea, they had a much better preparedness to face the COVID because they had faced the SARS epidemic just a few years before. So that was vivid in their memory. So the compliance with regulations, compliance with respiratory etiquette, mask, and avoiding public overcrowding, everything was much, much better. They came up with a better thing. So this is the availability heuristic. The best example I can give for availability heuristic is when they keep telling stock market is crashing down because of election results. So you keep thinking, okay, everything is going down, down. That is because that information is repeated so many times. It's coming in scrolling in the news channels, and Arnald Goswami keeps shouting that it is coming down, coming down. So you kind of think that that is what is happening. So that is the availability heuristic. The second one we have to look at is what is called as anchoring effect. So if I say that this mug costs 300 rupees, that sounds like a big amount of money. Suppose it was 1,000, now it has become 300. Okay, it looks like a lot of free money. So that's how the free money went. And salespeople use it in a very, very effective way. So the example I can come up with COVID analogy is, so vaccine adoption in populations with clinical trials, where they had done clinical trials. They found that this was working and all. The adaptation, the vaccine hesitancy was much less in those populations compared to the populations which had no exposure to vaccination. The other thing is, how do we frame this question? So, do we present a good information in the beginning itself, right? We can show this glass as half full or half empty. And halo effect, which is very commonly seen, right? If the student walks in and he looks quite neat and well dressed and he speaks English in a proper way, wishes you, you kind of start thinking it is a good student. And similarly, the first answer is written in a very nice way, neatly with diagrams, emphasizing important points. You kind of tend to look at the things. So, halo effect is the way in which it is framed. So, many a times the brain will say, okay, the first one was good, so it is also likely to be good, the next answers. So these are the things which happens because of the content per se, the content, how it is presented and how it is framed. The third most thing when we talk about biases is our ability to engage with content. Okay, how do we look at it? So we try to agree with things which agree with our viewpoint. So you have some idea, hunch. So I've heard the arguments, I've thought about it. I want to make a decision. So let me look at it. The first thing which agrees with us, with what we already believe in, is what we do. So this is likely to be the cause of this. So you look at it and say, yes. So I'm thinking like this. The whole world confirms that this is also like that. So that is conformity bias. False consensus. You try to think that whole world is agreeing with what you got to say, right? You think you only look for people who would say yes to you. The other one is representativeness heuristics. So sometimes we try to overestimate the possibility of bad things happening and underestimate the high probability list. So the best example of this is when the Jaws movie came out. So there was this shark which was threatening a very calm seaside town. So, but the effect that the shark had and was so bad, quite a few years, people were not willing to go towards the seaside towns in US. So that is, they overestimated the possibility of a very, very low risk event occurring. How often we see shark coming and eating people in the beach. So that is representativeness heuristics. The other one is bandwagon effect. That is called as, that can be explained by what is called as groupthink. Everybody is doing it, so it should be right. We should also follow, rather than try to analyze whether this is suitable for us or not. I don't have to give examples. We know in every day with all these things, no, all colleges are doing. Who is the they don't ask what is the merit of your statement. The question asked is how many people are already doing it? How many colleges have already implemented it? If all of them have implemented, then it is likely to be correct. So you need to go. So that is the tendency to agree with things because the majority goes. So that is how we engage with the content. There are a lot of biases. And when we look at it, no, there's only one instrument which is ever described in the humankind. One is which has 100% sensitivity, 100% specificity, zero false negativity and false positivity. That is what is called as a retrospectoscope or hindsight. I knew. So you always try to distort. I always said that this thing is likely to happen, right? Memory distortion. It had to happen because they did it this way. This is how they would do. And I knew that it would happen. I predicted it to happen. So that is how the human brain tries to look at information. So it tries to say that in hindsight justifies what all decisions we have taken or not taken. The other cognitive bias which comes into bias, this is it depends on what is your performance level and how do you estimate yourself. This is described by two psychologists by name Kruger and Dunning, because people who are high performers always try to underestimate their performance. So Einstein says, the more I learn, the more I realize I don't know. Whereas the opposite is true. People who have low performance standards or who perform poorly try to think, always overestimate their performance. We actually have seen this with our students also, right? We actually did something called as an exit interview. Please rate yourself, self-rating of yourself on skills. Where do you stand with regard to this? So the students who really were good with the skills, which was measured by ASCIIs, they always underestimated themselves. Whereas the students who did poorly actually in the observed performance test always had an overestimation of their own capabilities. So Einstein versus Trump is the Kruger-Dunning effect. This is a nice cartoon which I found. The other cognitive bias we see is what is called as a biased blind spot. So we always try to think that I am less biased than others. All others are thinking like this. I am always correct, whereas others are likely to make mistakes. So if I come late for work, it is because of very bad traffic conditions. If somebody else comes late for work, that is his habit. All the time he comes like that. Most of the times he doesn't take work seriously. So we have a biased blind spot. We also have clustering illusions. We keep seeing this in the media all the time. Conspiracy theories, no? You try to connect dots and make shapes when nothing exists. So you try to put together totally discrete facts and come up with some kind of an illusion and try to sell that also. The other cognitive bias we have is what is called as a sunken cost fallacy. I have already invested so much into it. We have put in so much effort to get this project. We know that this project is not taking off. We know that it is not working out in the way in which it is supposed to work. Any new venture, startup, okay. But because we have already invested in that, we want to continue or persist with that effort. So this is in the financial world, it is called as a sunken cost fallacy. Already so much of effort gone in, try and persist because of that. The other thing, these are biases. These biases are nothing but the way in which your brain tries to process information. So these are, what do I say, is not truly something which you keep thinking, but it is as a part of coping mechanism or adaptive mechanism. But what I'm going to describe as logical fallacy is the way in which your thinking process itself is wrong. So when we talk about the logical fallacy, it is a flaw in reasoning. Okay, suppose using that one new bill has been drafted about digital data protection and privacy. Okay, so if you point out that these are the flaws in this bill, so some society is coming up or a set of lawyers are pointing out, or citizen groups are raising objections. So instead of looking at the merit of their argument and see whether there is a real flaw in that, try to find out flaw in the person who is telling it. So there is in the reasoning process itself. Who is he to question? So that is a logical fallacy. Whereas bias are predictive patterns of thought. So this is a coping mechanism. That's all. So these are the common logical fallacies. Slippery slope, no? So suppose we don't do this, then NMC will come and de-recognize our college. Suppose we don't do this, this is what will happen, and we are doomed for it. Okay, so you claim that one single event is likely to give rise to a chain of future events, which will give rise to a very negative or bad outcome. Straw man is to try to oversimplify facts. Okay, this person uh, is doing very well because as the movie, which came sometime back about Munnabai, Lagairao. The Skurana added one K in front of his name. So he put double K for his. From then on, his business took off and he became a very, very successful businessman. So arguing, making it oversimplified. Then ad hominem is what I spoke about, attacking the person rather than attacking or making an argument of this. So these are some of the logical fallacies. So if you think about it, you would actually see any number of examples of this which occur in our everyday life. So these are certain signs that we think about whether cognitive bias is in action. So how do we protect ourselves from this? How do we ensure that our decisions follow a critical thinking process and are not carried away by bias? So these are the signs that bias is in this. If you pay attention to information which confers only to our opinions, which says yes to our thinking, then we think probably bias is at work. Assuming that everybody else is sharing your opinion, whether positive or negative, or beliefs, it's also a form of cognitive bias. We think that having some knowledge is enough. Assuming that you know everything about it when you have a very little knowledge, and you think that that's all there is to know about it, is also a form of cognitive bias. So these are suggestions or indications to say that this bias is at work. So I'm seeing a bird. It's yellow in color. There's a round body, very perky tail, short beak. I'm not very sure what it is. I cannot recognize this pattern. So I analyze. These are all the features. I try to calibrate. So what are the birds which are yellow? Then I'm asking which are the birds which have a round body. And I'm trying to find out which has a short beak and a long tail and all that. And then come to a decision that this is the yellow bird. I don't even know what it is, some form of sparrow. And this is likely to be a critical thinking and correct diagnosis. So this is what we call as systems 2 thinking, which is a much slower or a deliberate process. We use it for complex decision making. It's a conscious, effortful decision, more deliberative and logical. And that the example we can look at system 1 and system 2. When you normally walk, you don't think how you're walking, okay, how you are keeping your spine, which leg goes in front and how each leg goes behind, what is the length of your stride, all that you don't think, you do or walk automatically. System 1, effortless, right, which is automated almost. But imagine if you are going to go on a hike in a mountain and you are really climbing a steep slope or very irregular surface in the mountain. So there, each step of your way, each foot fall you take, you are very deliberate, you are conscious, you put in an effort and try and analyze whether this is a safe place to put my foot, whether this is going to cause slippage, should I have a support going on. So all this you keep thinking. So that is systems 2 thinking process. See, 16-year-old right left fossa pain which has caused migrated from the periumbilical, straight away say acute appendicitis. So this person has got a right left fossa pain, but it started rather than as a pain first, it started with fever for 3 days. He also has some bleeding PR. likely to be an ischemic bowel disease. So that is a, or if we need to consider the possibility of an ischemic bowel disease, that is systems 2 thinking, critical thinking, and in action. So system 1 thinking is green thinking, which is instinctive, automatic, spontaneous, and consciously guided, very fast, and it keeps going. Whereas system 2 is red thinking. It's more of a higher order executive functioning, the thinking which analyzes, assesses, and improves what you take instant decisions. So heuristics can help you to filter out the information. But if critical decision is involved, you need to resort to more deliberate process of thinking and decision making. So to say the least, critical thinking is the ability to think clearly and try to find out the logical connection which exists rather than try to use heuristic to go from dot A to dot B. So if you are a critical thinker, you are able to reason, you are an active seeker rather than a passive recipient of whatever information which is going to come to you. So if you are going to think critically, what are all questions you ask? So you are trying to find out what is happening. You try to gather all the information. Think about what questions will clarify the further information which is required. You're going to ask why this is important, whether there is any significance and whether it agree or not. And you also ask, what is that I'm seeing? What is that I'm not seeing? What is hidden behind this particular agenda? How do I know that this information which has come to me is authentic or not? How many fake circulars from NMC keep circulating in WhatsApp universities? So do I ask myself whether where did this information come? How was it constructed? Who is saying it? And what if? What are the other ideas or possibilities which is existing? So these are all this is the cheat sheet for critical thinking. So we need to ask what is happening, what is the relevance of it, what is seen and what is not seen. How do I know that this information is correct or not? Who is telling and who is influencing who is telling something, and what if the other possibilities. So critical thinking is having a healthy dose of skepticism, examining assumptions and the basis of our assumptions, challenging the reasoning process, and uncovering the biases which exist in the human brain. What it is not memorizing, definitely not group thinking just because everybody agrees, don't agree. Think about whether this is applicable and acceptable. It is not blind acceptance to authority, which you say most of the times, and it is not believing in stereotypes. I know that I'm touching little sensitive areas here, but that is what it is. So why do we need to teach critical thinking, or why do we need to practice this? Basically, we need to understand what is the link which exists between ideas, what is the importance and relevance of data and ideas. So our decision making in most circumstances should be data driven decision making rather than gut feelings, which will help us to go, because we are dealing with vital information, we are dealing with patients, we are dealing with large body of students, etc. We need to recognize, build, and apprise arguments which are for and against, so that we have a clear logical thinking process. We are able to put forth our viewpoints in a better manner. If there is any inconsistencies or errors in our reasoning, we'll be able to identify that, and we'll be able to reflect or justify our own assumptions, beliefs, and values. That's a very, very important thing. Why do I become a proponent or an advocate for this particular reform, whereas why I reject certain propositions? That needs to be explained. You can't say, I am saying so, that is correct. We don't, as Aristotle says, no, we don't do right things because we are virtuous. We do the right things, then we become virtuous. So that is what is this. So excellence is nothing but a habit which comes. So we need to use a systematic and a consistent approach to problem solving and decision making. needs to be data driven. The data needs to be interpreted without any inconsistencies or fallacies. And we need to build arguments to support our data, and we need to critically analyze those arguments before we present it to people. So that's it, friends. I wanted to talk to you about cognitive bias. So if I were to summarize, there are a lot of common causes of cognitive biases. One is the limits of human brain itself, individual motivations, the mental shortcuts, what we call as heuristics, and sometimes social pressures like groupthink, and emotional or gut feelings. These all cause common biases or errors in decision making. And we need to overcome this by getting information from less biased sources. So if this information is coming from one source, can I look for it in a more neutral, more stable source which can be relied upon? Can I read content from multiple sources so that I know that it is authentic? It is not the same content which is forwarded 200 times. And can I engage in discussions without biased moderation? So that is how we look at overcoming bias in critical decision making. So how can we challenge our own biases? The first and foremost is we need to be aware that such things can exist. We need to consider what factors. Is it just an emotional decision? Is it just taken at the heat of the moment? Is it done under undue pressure because of others are doing it? So you might need to consider what factors influence your decision making. You need to reflect on past. Reflections are a very nice way to learn from your experience. That's how we make sense of what we have experienced in the past. Sometimes we need to think aloud, putting it in writing, talking out to somebody, explaining your viewpoint helps you to look at it very, very critically. You can see multiple perspectives, involve all stakeholders in decision making, consider various alternatives, seek external opinion and see if it validates what you are coming up with. Look for things which don't fall in place. If everything agrees to what you have to say, which is very, very, very unlikely. So look for outliers, look for disconfirming evidence, which is trying to say that something is going wrong. And most important of all, we need to practice intellectual humility. We can't always be right. No, only Krishna Paramatma has been found to be 100% right all the time. We need to, even he agrees that he is fallible, even he agrees that he has made decisions which are wrong. So we need to look at things, and if something goes wrong, we should have this humility to accept that things have not gone wrong well, or we have been biased in decision making process. Basically, that means we need to be mindful about our thought process, mindful about our actions, be reflective, and be willing to learn and accept those decisions. So that's all I have to say about how cognitive biases affect our thinking process. Why I try to explain to you why this happens, because it's not something which is very conscious. I tried to tell you how we engage with the content, and the content itself can got biased. And I have given you some tips and strategies how we can de-bias or look at our decisions critically and do this. So we also discussed about the two systems of thinking and when to use deliberate thinking process and when to use heuristics. So that is about it, I suppose. And I've stopped sharing.
I have allowed everyone to unmute. Any questions or any comments are most welcome. You can unmute yourself or raise your hand, and I'll. A lot of yes, Dr. Swapnil Parilkar.
Yes, sir. So,
Yes,
Madam,
Swapnil.
wonderful talk. Actually, converting Kahneman's work into what applies in medicine, and I really liked it. And of course, Kahneman worked with his friend Amos Tversky that I
Yeah.
read in, and he recently passed away.
Oh, yes, sir. Actually, it all started with reading their work. I got their book, the systems thinking approach. So then it kind of, when you start looking at it, you know that you're kind of being assaulted by it in everyday life. So I thought it is an interesting thing to share with people.
Yes, lot of compliments are coming on the chat. And
Ma'am, so can I ask something?
can you introduce yourself? It's
Yeah,
best.
ma'am, I'm Professor Joya Ghosh. I'm a convener of Regional Center West Bengal. So it was such a insightful sort of talk. But my query is, ma'am, I mean, I was just trying to find a similarity between what you were telling and is there with machine learning, like how the big datas are given to AI, and then I mean, is there some link there? I mean, I do not know, like how neural networks are being
Yeah.
the similar. I mean, I was just trying to figure out whether this could be something similar to that.
Uh,
Um,
Thank you very much for bringing up that, madam. When we talk about deep learning, machine learning, okay, we are talking about large language models, LLM, your chat GPT and others are examples of that. So basically what they
that's
do
right.
is they try, what they have done is they have fed extensive bits of information to chat GPT. It's like a consumer. You keep on feeding. I think till 2021 September is what 3.5 chat GPT has been introduced to. So it is kind of read all those, like imagine itself to be a teacher who has read millions of books and who has assimilated the data. So what it tries to do is to do some kind of a profiling. It looks at sequence of words the way when you are asking it and tries to look at its database and come up with solutions. So that is in short how this large language models work. And when we look at big data also tries to do some kind of profiling. It is trying to see that we leave digital crumbs everywhere. Like when you're traveling, this is how you booked your bus. This is the meal you took. This is how what you bought on the way. This is what time you got into the flight. So much of information we keep leaving behind. No? So it tries to read all these things and tries to make some connections. So always these connections need not be correct or it need not be good. So if you see Chat GPT, it always comes with a warning. Please verify this information which is present or not. So all this big data or all this Chat GPT, what it tries to do is what is called as pattern recognition. Looks like Aunt May, sounds like Aunt May, likely to be your Aunt May. So that is the example for it. I
yes,
hope I
ma'am.
have
Thank you.
answered your question.
Yeah, yeah. Thank you, ma'am.
Yeah, I like Dr. Prashant's comment. This has a lot of applicability in political narratives. People are promising more cognitive bias instead of reasoning, and reasoning is a part of scientific process. Yeah, true, extremely true, sir.
I mean, there are a lot of applications in medical education. How do we bring, I mean, you can't apply all these at the same time. If you just, I mean, usually you take only one uh, area at a time and focus, go deeply, deeply, deeply. So,
Uh,
which one should be the best?
Actually, what we need to do in medical education is to start teaching our students how to think critically from a very, very early stage. So, having recognized the importance of this approach, right? So we need to induct them into critical thinking and decision making process. So we do a kind of 2 hour session in the foundation course on critical thinking. We teach them to collect information from their batch and come to some kind of conclusion. We give them an article and try to read. So we do a lot of exercises to walk them through this. We tell them that there can be difference of opinion between the class itself. So when we try to do multiple exercises to teach them that how biases come in and how they can overcome those biases by critical thinking. It's a learned skill. It is not something which automatically you are born with. It can be taught and it can be developed. So that is what we should be doing. We have to tell students to critically analyze their decision making process and come to it, be it in the form of scientific article, be it in the form of listening to somebody's arguments and then making a judgment based on that. That is what I think we should focus. If there is one thing we need to take away from this session, that we need to start teaching critical thinking skills from a very early stage and move our students along in that way. So somebody has written, this is a very good talk for AdCom. I think we need to take that and use this.
Yes, Dr. Haneeb has raised his hand. Haneeb Sohaib.
Yes, yes. Thank you very much. Is my voice is clear? My
Yes.
voice is clear. Yes.
Yes, sir.
Thank you for organizing this activity, and thank you for the nice presenter. Thank you very much for this talk. I am talking with you from Iraq. I am a professor from Kufa University at the middle of Iraq. I just want to ask one question regarding type 1 or system 1 thinking. Do you advise to abandon this thinking, or we can go to type 2 system thinking, and sometimes we need to work in the system 1 thinking? Because as you said, some experts, they go to rapid actions, fast actions. They don't so much critically analyze any situation because they have a lot of experience. What do you think? Thank you very
sir,
much.
Thank you very much for joining from Iraq. And see, I'd give a personal example. I am a surgeon. So when I'm doing, let's say, a hernia surgery in a child, so there are a lot of steps which I do on an automated fashion because I don't really think how I'm taking a suture or how I'm tying a knot because these have become an automated process. So unless you use system 1 approach, no, you automate a lot of common steps. You can't really do surgery very fast. No, you will be doing like a first year student or an intern. So each step will be a deliberate process. For them, it is a new step. It has to be done in a very deliberate fashion. So it takes a much longer time. It takes much more effort and mental strength for them to perform that surgery. Whereas if by virtue of doing thousands of cases, so I'm able to do this because I have moved what was systems 2 into what is system 1. But however, let us say that I'm doing the same hernia. If I have an unexpected finding, if the bladder is there as a content in the hernia sac, or if I have a critical bleeding which occurs during an abdominal surgery. So at that time, my actions are very deliberate. How to control this bleeding, how to ensure that this content which has come in is not there. So you need to use both system 1 approach as well as system 2 approach. Many of the things which you can routinely do if you want to, if suppose no, in each OPD, every single case, if I'm using system 2 approach, then if I have 100 patients in the OPD, it won't get over at all. Or if I have to do that. So, but we need to identify which are all the outliers, which are the things which do not fit into the pattern, which are standing out. We'll always say that most of the yellow birds are sparrows, but is this some other bushy-tailed bird which is new? So that is where systems 2 approach comes in. System 1 is essential for improving your efficiency. whereas system 2 is essential for improving your effectiveness. I hope I have answered your questions, sir.
Thank you very much. Thank you.
Thank you, sir.
Thank you, ma'am. Really, it was an excellent talk and something which needs to be, which must percolate into our thinking. So,
Thank you very much for the opportunity, sir.
thank you. So, with this, we end, and the recording will be available on YouTube. I've shared the link.
Thank you.